All exercises are not created equal. And this rear foot elevated split squat or unilateral exercise is going to give you a completely different outcome compared to a bilateral exercise such as a barbell back squat. So in this video, we are going to discuss exactly why you should choose one over the other depending on your goals. What's up, guys? My name is Dr. Brian Larish, and I'm the owner of a cash-based physical therapy clinic called Performance Redefined. Additionally, I'm the creator of the PT Growth Academy, where we strive to raise the standard of care in the physical therapy profession. We do that through the Clinical Coaching Specialist certification. Now, in today's video, we are getting intentional with the exercises that we choose. I'm talking about bilateral versus unilateral exercise. It's a thought that is usually overlooked. However, you may or may not be achieving the goals and results that you want, whether it's for yourself and or a patient or client, because you may have chosen a bilateral exercise when you need a unilateral. And we're going to discuss exactly why that is and then talk about examples at the end. So make sure you stick through the whole video. And with that, let's jump in and really start to understand the difference between bilateral and unilateral exercise. So we're starting at the whiteboard. Take a second now to grab a pen and paper or cell phone, anything that you can use to write a couple of notes. Now, for this video, we are talking about the barbell back squat as our bilateral and a rear foot elevated split squat as a unilateral. And that's just for an example and demonstration purposes. These principles that we're about to write down are a common theme throughout any bilateral or unilateral exercise. So keep that in mind as we go forward. So let's start with bilateral. What's going to happen with bilateral movements? Well, we're going to start to get compression when we do a bilateral exercise. It's going to be more strength base. We're going to add stability in. All these things are going to decrease mobility. Now, is that good or bad? I don't know the answer. Only you know the answer. It depends on your patient's goals. We're going to talk about examples after, but keep that in mind. This is not good or bad. This is just an outcome from a bilateral exercise. And we need to really understand patients' goals and their patterns to really know, is that the best option for them? Now, you know bilateral, you actually know unilateral. It's the exact opposite. So if this compresses, then a unilateral is going to expand. If bilateral is more strength-based, this is going to be more functional or mobility. And finally, we're going to see that it's going to increase mobility. So it's just the opposite of a bilateral exercise. Now remember, this isn't good or bad. This is just an outcome. What makes it good or bad is, are we using these principles in the patterns of our patients to correctly choose the right exercise? So remember these couple of key items. In general, compression, stability, strength, mobility, space, function, and use these principles as you start to make selections throughout your programs, whether it's for your patients or if it's for yourself. So let's talk through an example so we can make better sense of this unilateral versus bilateral. Now, as I do, I'm going to use a couple of terms that I use in the Clinical Coaching Specialist certification program. And if you're not familiar with those, I'm going to explain it my best, but if you really want to level up and start to see the human body in a different way and get better results with patients and clients and or yourself, I encourage you to check it out. I will leave it in the link below. Now, let's imagine we have a wide infrasternal angle. This is someone that has a greater than 90-degree ISA, infrasternal angle, and they are usually compression biased individuals. This means that they're going to be better at deadlifting. They're going to be better at producing power, moving in a horizontal trajectory. If this type of person comes in and is looking to get out of pain, do you think a bilateral barbell back squat or a unilateral rear foot elevated split squat would be a better option for their pattern and their goal. Their goal is to get out of pain. Well, let's talk through it. If they're already biased towards having compression, do you think adding more compression is going to be the best option? Probably not. Do you think that giving them more stiffness and stability is going to be a better option when they're already stiff and stable? Probably not. But the thing is, a lot of us go to a barbell back squat because it's such a common and familiar exercise. And we do it with these types of individuals, and then we don't get the results that we're looking for, and we're confused because sometimes it works and sometimes it doesn't. Well, chances are, if we're looking to get this person out of pain, it's not going to work. We're driving compression on top of compression. They might get super strong, but they're going to get super stiff and more stiff and more stiff and probably have more pain because ultimately they're probably coming into you because they need to expand. They just don't know how to use that verbiage with you. So for this type of individual and pattern, a rear foot elevated split squat would be a better option to train the lower body. Why? When we have one leg up and one leg down, the body is already rotating. We're creating space, expansion, and we're going to go through a much greater range of motion. So if someone's looking to get out of pain but still train, getting intentional with a unilateral or a split stance compared to the bilateral is going to be a much better option. Now, I will say, if you have someone that comes in and they are a wide ISA and they're already compressed and stiff, but they're a power lifter and they want to get better at their sport, is a bilateral exercise or a unilateral exercise going to be better? Probably the bilateral. This is what I was trying to explain, that these are not good or bad. It's just we have to know the intent of the goal, the reason why the person's there, but also their pattern. Now, is it going to still drive them in their kind of compressed, stable pattern? Sure. Is it their goal? Yeah. Do we want to have them do some unilateral stuff, probably on different days, maybe integrated before? Yes. So the one thing I want you to take away from this entire video is just to get more intentional with the exercises that you choose. And when you're intentional, you start to understand that the results and the mobility and better feeling that the person is experiencing is directly correlated to the exercises that we're choosing. And it's such a simple switch to take a bilateral exercise to a unilateral exercise. A lot of people think we have to totally take away. That's not always the case. We can just switch it to give them what they don't have. In our example, they were already compressed. We're giving them expansion, but still training the lower body. If they're going to continue to have pain, they come in with compression. We give them compression. They still have pain. So in general, compression, we need to find expansion. Expansion, we need to find compression.